All right, so for this video, we're gonna be talking about shoulder mobility self-assessment, meaning how do you assess your own shoulder mobility and how do you make sense of what you need to work on. So I'm gonna show you the exact routine that I go through with my clients in person and online to assess how their shoulder looks and how their shoulder is functioning. So the first one we're gonna look at is shoulder flexion, which is basically coming straight up this way. And what we're looking for is you want to record yourself from the side here, one arm at a time. So you go all the way up until you can't go any higher. You're going to hold it for a few seconds and then come back down. Now with all of these, what you're going to end up doing is you're actually going to be pausing and maybe taking a screen capture. So a screenshot, or if your phone allows you to take a screen capture, you can save it and compare sides. So that's one side, then you go to the other side, obviously, and look for any differences. The next one we're gonna do is shoulder extension. So that's moving your hand behind you this way. So the shoulder extension would be like this. Now, what we're trying to do here is we're not allowing the shoulder to tilt forward, or not kind of assisting or cheating. We're trying to keep this upright and moving strictly at this joint. I don't want you to think about it too much with shoulder flexion, but with extension, we do want to be more strict with that. So that's number 2. Number 3, again, we're doing this on both sides. Number 3 is going to be shoulder abduction, which is basically this motion. And usually it's nice to look from the back. So again, you'll do one arm as high as you can, hold it for a few seconds, come back down and switch sides. Now this one, depending on if you have like a really painful or sore or weak shoulder, this next test might not be appropriate, so I'll show you an alternative in a second. But what we're gonna be doing is putting our arm up at about a 90-degree angle here, and we're gonna be doing active external rotation. So we're gonna try to rotate as far back as we can this way. We're trying not to move our elbow a lot, we're trying to keep it in place. So it's like we're rotating around an axis. Hold it for a few seconds, and then we can switch sides. Do this side. Then we're gonna do internal rotation at 90 degrees, about right here. Rotate down this way as far as you can. This is one that's really easy to compensate by letting yourself again slouch or let the shoulder dip forward. So try to put your hand here to monitor for the motion, and then come down here and then switch sides. If you're having any issues doing the active external rotation or internal rotation, you can do the same thing laying down on the ground, supporting your arm on like a folded up towel. Again, put the camera low. So if you imagine me laying down, my arm would be supported, I'm on my back, and I would let it fall back this way, measure it, and also come this way, again, not letting my shoulder pop up. So that would be a way to be a little bit easier on your shoulder if you can't tolerate doing the active variation. Okay, then we're gonna be doing hand behind the back. So this one, for a lot of people, can be really uncomfortable, so be careful with this one. But again, we're gonna take this hand, we're gonna go behind our back as high as we can go. Now, we're not doing this and kind of crawling up our back. We're trying to get as high as we can get, and once we set it there, we stop. And then we compare to the other side. You can see my right side is more limited than my left. And then lastly, you're gonna be putting your hands at your sides, keeping your elbows pinned to your side, and we're gonna do external rotation in this low position. So not in the abducted position, but in this all the way at the bottom, no elevation. So what you're gonna do is you're actually gonna do both at the same time. Looking straight at the camera here, you're gonna go out as far as you can. You can actually look down to see if there's any significant limitation between sides. And then you could also bend forward so that your head is facing the camera and you can see it a little bit easier. You can do one at a time, or you could do both at the same time and see where your limitation lies.